active and passive immunity. I believe this is where we left off. Okay. Active and passive immunity. There are some antibodies, some immunity you're born with, and it isn't the same for everybody. And that would be it would be an innate immunity, not necessarily active or passive. The active immunity would be like with a vaccine or a disease. You are exposed to foreign antigens. The immune cells respond by making copies of themselves. Is that humoral or cellular immunity? Actually, both. What happens is the T cells, the actions are different. Remember, the B cells can reach out and touch you. The T cells have to snuggle up. The B cells are humoral immunity. They make the antibodies, the B lymphocytes. And the antibodies will go out along with the cytokines. The antibodies will attach to the foreign cells. They will attract complement. Complement will attach to the cells. And when you hit complement factors 5 through 9, they'll bore a hole in the cell and essentially allow enough water or fluid in to destroy the cell. But active immunity, cells, this will be for both T and B cells. Cells are exposed to foreign antigens. Immune cells respond by making many copies of themselves. This protects the bodies from future infections. Somebody that gets mumps as a child or measles as a child, not too bad as a child, could be pretty devastating as an adult, especially like the mumps in the male. Your body senses that the mumps virus is foreign. It makes antibodies against it. I think we talked about it, you go to the doctor, my kid doesn't feel good, the doctor walks up and goes, lymph nodes are swollen, and he's got the redness, he's got the measles, take him home, put him to bed. Or he's got chicken pox. I don't know what you guys did, but I had one son with chicken pox. I sent the other one to sleep with him. I wasn't going through this twice. And the younger son got a very mild case, but we were done with it by the time we were 5 years old, 5 and 7. Anyway, that is an active immunity. Say chickenpox. They got exposed to chickenpox. The body recognizes it as foreign. The immune cells, the lymphocytes, make antibodies to chickenpox, the varicella, and they're immune for the rest of their life. Now, it doesn't mean that they don't pick up the virus. In the primary exposure, the first exposure, it may take 5 to 10 days to get the antibodies, to get the body worked up into making the antibodies. By that time, they've got chickenpox, they've got the blisters, they've got the fever. That's why you do it when they're young. It's not bad. But in the future, they're exposed to chickenpox again. They can be making 2,000 antibody molecules a second within 2 hours. That's how fast the body responds. Because these lymphocytes there are some memory cells, they're stored away in a lymph node someplace. As soon as they see chickenpox, they go, I know what that is, and I know how to deal with it. And they make their antibodies. Active immunity is used to make vaccines. We've talked about that a little bit. Vaccines include an antigen but are not virulent. They're not disease-causing, or they don't cause the disease as bad as the primary, the thing you're trying to protect from, the primary disease. An instance like that would be Jenner, Edward Jenner, in the late 1700s in England. He observed that the milkmaids that got cowpox never got smallpox. So he figured, hey, they've got something that's keeping them from getting cowpox, from getting smallpox. So he took a person with cowpox, and they still get the pustules and that, but he took a needle and he went into the pustule, and he got a lot of the pus, essentially, the organism on the needle, and took another orphan, went to experiment on orphans those days, and inoculated him with the pus. At that point, he came back a while later, I don't know how much, and inoculated the same kid with a lethal dose of smallpox. Now, the kid he didn't get sick at all. He did just fine. But who wants to be the first? Who wants to be the first when you're doing that? But the kid did fine, and that was that really was the basis, the first start of vaccines. And now they did have a vaccine before Jenner where they took somebody who didn't have smallpox real bad and gave them, but it was still a virulent strain of smallpox, and people kept dying from it. So they, but this is where the vaccine started, and the word "vaca" from vaccine is for cow, because of this, because of the cowpox. Of course, when the settlers came to the New World, some ship's doctors said, I'm going to get to, there was one place, one of the Mexican Spanish colonies, the doctor said, you guys need to be vaccinated against smallpox. So he took some blood from some of the sailors and used them to vaccinate most of the village against smallpox, because the sailors had already been vaccinated. And the whole village came down with syphilis. So, gotta be careful. Anyway, active immunity to make vaccines. So you have a virulent pathogen, disease, i.e. smallpox. You can have an antigen that are not altered and inoculated, or you have a virulent and it's attenuated. So if you can just get the antigens, you can get something like the cowpox, and it's got the antigen. You don't alter it, you knock it, you get an active immunity. Virulence, you have to attenuate. That's the Salk vaccine. The Salk vaccine took polio, treated it with formaldehyde, knocked the virulence down, and that was the first vaccine for polio. Sabin was able to breed a live strain of polio that was not virulent, but still gave us the immunity. So those are the two different Sabin. Sabin's the one you guys all got your polio vaccines on a sugar cube? I mean, that started in the 50s, so, It's all shots?
Yeah.
Well, yeah, they get DPT.
Yeah.
Now. They get it all in one shot. What's that?
Oh, now they have to get it again from California school laws. Are regulating that you have to do whooping cough again before they go into school.
Hey, I had whooping cough and I was sicker than a dog. My brother and my mother had polio. I'm all for vaccines. I'm all for vaccines. Well, titers are, we do titers. We do titers for hepatitis, people that we vaccinated 3 times for hepatitis. And, sometimes they're positive, sometimes they're not. It just doesn't really tell you.
What are
Titer is where I would take your blood and look for the antibody. So, and I don't know if anybody, I don't think I've ever done a polio titer in my, or whooping cough titer in my life. Now, not for immunity. Yeah, I mean, I do it when they're looking for somebody that's sick.
Is it possible to get the disease from the vaccine if it's a virulent vaccine?
Well, they don't give a virulent anymore. They're all attenuated or dead.
Is it possible to get it from the vaccine when, whatever?
I would say, there's probably a very small possibility because you still have people that die from vaccines. Usually, it's more of a reaction to the horse serum or the chicken egg that they use to grow the virus. But,
Remember the disease used to get a vaccine?
It's probably 1 in a million.
But if you get the smallpox vaccine, you can give somebody else one with the use a week. You have to keep it covered and make sure nobody else touches it because if they touch it, they can end up getting smallpox. Even if it's like you're wearing a piece of clothing and it touches it, they borrow that piece of clothing without it being washed first and has to be washed in sanitized water, then they can get smallpox.
Even if they've been...
I would have a lot of trouble going with that.
That's what I was told when I got my smallpox vaccine.
No, that's scare tactics. I'm sorry, because there are only maybe 3 or 4 labs in the world that have any live smallpox. Smallpox is one disease that we have eradicated. There hasn't been a case of smallpox in the world since the 1980s. And, I had my smallpox scar, and that's an attenuated virus when you get it. There's no way you're getting smallpox if they're injecting it into you and you're not getting smallpox, nobody's going to rub up against it and get smallpox. It's an attenuated virus.
They told me I couldn't hold the baby while I had the baby.
I think they just didn't want you going to be. No, there is no way. There is no way. They would never. We have eradicated smallpox from the face of the earth right now.
This doesn't have to be in a certain temperature. I mean, like it has to have a hose and have a.
I honestly don't know because by the time I got into medicine, smallpox, I've never seen a case of smallpox in 35 years. I've never seen a case.
Do they still vaccinate
No, they don't vaccinate.
Yeah, we didn't like.
They may vaccinate the military yet
Oh.
because of the threat of germ warfare, but they're not vaccinating anybody regularly anymore.
Like we're going to like Korea or something like that.
They're gonna. They brought it back a few years ago, and I volunteered to get vaccinated again for it, but then they decided they stopped the program. So
That's the one with the big circle scar.
that's where they.
Yeah.
I got mine with my leg though.
Yeah, weird, actually.
Probably that's for scarring then.
Okay, let's get going. Infection, active immunity. It takes 5 to 10 days before antibodies can be detected in the blood. This is your primary response. In 5 to 10 days, you're going to get sick. Later exposure, same infection, less than 2 hours. And you don't get sick. You don't even know you've been exposed. It's great. And I think we showed you this one before. This is how fast your secondary response is versus your primary response. Clonal selection, secondary immune. People will inherit lymphocytes specific to almost every pathogen, but there's so few that they can't really, they're not doing anything. You still need to have them exposed. Then you get exposed, you get a primary response. Again, you trigger a massive production of cells that can respond. After that, this is still part of your primary. After that, again, you've got the memory cells, and you can start making your antibodies a lot quicker the second time. Generally so quick that you don't even know you've been exposed. And this is it. Just first day, second day, you're making antibodies. By the 5th day, you're starting to kick them out. but by that time, you're sick. But the next time, 2 hours. Vaccines stimulate a primary response and active immunity without making the person sick. Not necessarily. But it's generally what they grow the vaccine in, not the virus itself. They use a killed virus. They may use a live attenuated virus. Or they may use a genetically engineered hepatitis B virus. They're trying to find one like this for AIDS. However, the AIDS virus is mutating so rapidly. The thing that saves us from AIDS is that, in all reality, it's very hard to get. If you got AIDS as easily as people could get hepatitis, we'd be in a lot more trouble. Okay, immunological tolerance. You need to avoid attacking yourself. And like I said, from the fetus, from the time the baby's born, you've got 30 to 60 days where it doesn't have an immune system. That's why the colostrum and mother's milk passes the antibodies for the baby to fight disease on through the breast milk. Some instances, the body will recognize at that point whatever it's been exposed to as self and not make antibodies against it. When we do a vaccine, it's recognized as non-self, and then it makes antibodies. In some instances, self cells are attacked. Mutations occur. If you have a mutation, remember, even when down at the DNA level, back in chapter 3, we talked about a DNA molecule that monitors the DNA sequencing. And if it decides that it's not right, it tells the cell to either fix it or destroy itself in apoptosis. Cells in particular organs are never exposed to the immune system. Your thyroglobulin is in the follicular cells of the thyroid. It's never exposed. If it does get exposed, your body recognizes it as foreign because it's never seen it before. There are 3 places in the body that they say are immunologically privileged, meaning that there's not an immune system in that area. The thyroglobulin, the inside of the thyroid follicles is 1. The thyroglobulin would be recognized as foreign. 2 would be the interior of the eyeball, because you don't want T cells getting in there and clouding up the vitreous fluid. You'd never be able to see. So there are what they call T regulator cells in there. If the T cells start to get in there, they actually eliminate them. Or else, anytime you got an infection, you would just essentially go blind until it cleared up, because the whole inner chamber of the eye would be full of lymphocytes. The 3rd place is the testes. The sperm are considered foreign. This is why if a man has a vasectomy, the body doesn't stop producing sperm. It just can't go anywhere. But at some point, there will be times that it will build up enough that it will leak into the extracellular or the blood system, or at least into the extracellular system. They're too big for the blood system. And at that point, the body will recognize them as foreign and will create antibodies against it. If that person has ever gone back and said, I'm going to try to have this vasectomy reversed, then all of a sudden they've got all these anti-sperm antibodies and don't bother, because it ain't going to work. Your bodies recognize the sperm as foreign, and it's attacking them whenever they see them. but they're called autoreactive, autoimmune, immunological tolerance. If the lymphocytes recognize or begin attacking cells, they're either destroyed or, like I said, there's another lymphocyte, a T lymphocyte called a T regulatory lymphocyte. And it attaches them and just essentially inactivates them. Passive immunity. Passive immunity is where you pass antibodies from one person to another. Mother to a fetus, mother to a child in breast milk, artificially via immunization. And so you have immunization versus vaccination. Vaccine, you're going to make your own antibodies. Immunization, you're giving them. For instance, rabies. You get somebody that that's been scratched by a bat or gotten mixed up with a skunk and sometimes a raccoon. They're going to give them the rabies antibodies. What they're doing is putting enough antibody in you to fight the disease so that the rabies virus cannot replicate on its own. Those antibodies, rabies shots are nasty. They're given in the stomach because you want a broad skin area for the inflammation. So they're given in the stomach, and they give them, I don't know, it's over 3 or 4 weeks, I think. But what happens is when the antibody's going away, you're not immune to rabies. You can still get, if you get exposed again, you can still get rabies again. The same thing with immunoglobulin they've made for hepatitis A. If you think you're getting hepatitis A, they're going to shoot you through full of anti-A immunoglobulin, but it's not an anti-A vaccine. It's just to fight the active disease at that point. That's artificial immunization. Passive immunity. Injections with antigens, in passive immunity you get antibodies. Source, person, the active immunity, the person's inoculated. In passive immunity, the natural, you're getting it from the breast milk, from the mother, from injections. Time, 5 to 14 days. That's your primary exposure. If you're getting antibodies in a passive immunity, as soon as they're in, they're working. Duration of resistance, long. You make memory cells. You can have that resistance for the rest of your life. It's not uncommon. Short, days to weeks. When you stop giving the antibodies, your resistance goes away. When it's used before exposure to a pathogen, we've vaccinated everybody in this room who got a DPT at some point, and every 10 years now you get a tetanus. If you've been exposed after 5, they're going to give you another tetanus before you're exposed. Sometimes they'll give you a passive before, but generally it's after you're exposed to the pathogen. After you're exposed to hepatitis A, after you're exposed to rabies, something like that. Tumor immunology. Tumors, abnormal cells that differentiate to an embryonic state. Tumor cells aren't these really big, wise, mature cells. They go back to the embryonic state. And in the embryonic state, a cell is less differentiated but divides very quickly. And this is what you see in the tumors. When you look at a cancer biopsy, when you look at tumor cells, when you look at the tests that we do for tumor cells, they're not a real mature cell, but they go back and they're relatively immature. But they get to they de-differentiate, but they grow very quickly. tumor growth and dedifferentiate reveal antigens that can stimulate their destruction. When in the fetus you have a liver cell that the body after birth has never seen, and then you get a liver cancer, and the liver cells dedifferentiate back to this fetal liver cell, as the cancer will, the body will recognize that fetal liver cell as foreign and create an antibody against it. So there's a couple of tests. Alpha fetal protein. Alpha fetal protein. It's a liver cell that the body has recognized as foreign. And when you order an alpha fetoprotein in an adult, you're looking for liver cancer. Okay? Another one would be CEA, carcinoembryonic antigen. Again, the cells, the tumor has dedifferentiated. It's back more to the fetal state, embryonic state, and since the body hasn't seen that before, because it was beyond that when the body was formed, or when the baby was born, it recognizes it as foreign. Carcinoembryonic antigen is a test we do all the time for colon cancer. I wish we had more tests like that. You know, you have your CA-129s, but those are, you're looking for different antibodies for, you know, CA-129 is for ovarian cancer. Anyway, benign tumors. Benign tumors are slow-growing, limited to specific areas of the body. Benign tumor could be a wart. That's a benign tumor. Now, you get a benign tumor, you know, my puppy has a benign tumor of the thymus. And so it's deep in her chest, and at some point it will grow enough that, you know, that it's going to interfere with the heart. At this point, she's doing all right. But it's not, it's benign as opposed to metastatic. Malignant tumors are fast-growing and spread through other parts of the body. That's a malignant tumor. Spreading is metastases. It's metastatic. They arise when the immune cells fail to stop the growth or the spread of the tumors. Tumor antigens. Antigens are due to differentiated embryonic antigens not recognized by the immune system. This is what I was just talking about. Alpha fetoprotein, CEA. Some arise due to mutations from carcinogens. You get exposed to UV light, you get exposed to chemicals, you get exposed to chemicals. These things are coming in, and what they're essentially doing is they're knocking, you know, UV light's going into the genome, and it's, boom, it's knocking out this, you know, this DNA molecule, or it's knocking out this, you know, they've got guanine or a cytosine, knocks them out of order. Now, you know, only about 10%, maybe even less of your DNA is actually used and transcripted. But every once in a while, this gets knocked out in one that's being used, and it may knock out one that regulates growth. You know, this is the effect of chemicals. This is the effect of radiation. This is, you know, this is what would we call the carcinogen. They are creating a mutation, and you're right down on the DNA level, on the amino acid level, on the DNA level. Others are viral antigens that you pick up. Human papillomavirus. You know, this is a disease that should be eliminated because you can vaccinate against it. Now, I would expect that virtually everybody in this room male and female, have been exposed to human papillomavirus. If you're past your 20s, chances are you are. You have. With a normal immune system, you never know it. Now, in women, especially women that have had multiple sexual partners, hookers, the chances of them developing cancer from this, cervical cancer, is much higher, much higher. That's where the Pap test came from. Because we can see the organisms in the scrapings from the cervix. And then you either go in and freeze them, or burn them, or cut them out, essentially. If you've ever seen, and I was going to bring a picture in and I forgot, of a human that has human papillomavirus along with is immunocompromised. It is, well, remember the picture of the guy with elephantitis? He looked almost normal compared to these people. They will literally, the warts grow unimpeded. And when they go in, they will literally take pounds of warts off these guys. It's extremely rare. But I saw that, and actually they had it on Grey's Anatomy.
Oh, is that the guy with the wood?
Yeah,
Oh,
that's human papillomavirus.
That was sad.
He was also in
Did he have the same disease?
yeah.
So he was actually somebody with human papillomavirus? Boy, I almost went out and got all my kids vaccinated that day. You're kidding this. But no, but you have to be immunologically compromised. You can't make antibodies. But it's pretty gross. Okay, overexpressed antigens may trigger an immune response. So if you've got too many, sometimes your body may react.
Is there a reason they don't give it to boys?
I think just because of the exposure, they do. I mean, they do give it to males.
Oh, they do.
They do.
As a regular child infection.
Not in no. I don't think they don't. I think they only do they give it to girls as a regular vaccine.
I think 10 years old.
Yeah, they do.
Yeah, well, they have to be a little bit older. It's like not, they recommend preteen and on.
Well, I would. I mean, this is a disease that we could eliminate just like we did smallpox. We could eliminate hepatitis B. If we vaccinated everybody, we could eliminate hepatitis B from the world. Or you did do like they did with smallpox. They didn't vaccinate everybody. They just vaccinated enough till they got it into pockets, and then they would go in and vaccinate that area. So there's a lot of people in the world today that never had a smallpox vaccine.
Which one's B?
Hep B.
Hep C is the one there's no vaccination for.
No.
What's the B?
Hep B, that's your,
A is oral equal or something, right?
B is blood, C is blood.
That's the one they, okay.
They do the antibody test for. What's that?
The 3 series shot.
Yeah. Okay, lymphocytes and tumor cells. Lymphocytes can provide immunological surveillance. They're watching for them. Tumor cells can invade by suppressing immunity within the secretions. You have what they call, I'm going to have to come back with FAS. It is a substance that inactivates lymphocytes, or it inactivates especially the regulatory lymphocytes. So here you have a T cell. This is the first slide we saw. T cell snuggling up against a cancer cell. What type of immunity is this? This is a fair question.
Cell mediated.
Cell mediated. because you have to reach, you have to touch, you have to snuggle up. As opposed to humoral immunity, where you can secrete the antibodies and attack them from a distance. And then here is the destroyed cancer cell, which also destroys the T cell, but it's worth it. Natural killer cells related to T cells. Now, they found natural killer cells in mice that the thymus has been genetically engineered or bred out of. The thymus is the part of the body, again, when the lymphocytes are released, the T cells seed the thymus and then come out of it, and then they stay in the thymus and they're released from the thymus. That's why they're called T cells. But if you don't have a thymus, there's no T cells. But they found that the mice that didn't have a thymus didn't get tumors like they might expect. And that led to the discovery of what they call natural killer cells. These are lymphocytes. They're a T cell type. They're a killer cell. They got to snuggle up. But they have a lot of different sites that recognize self from foreign. And they are your first stage of immunity. They're your first defense for immunity. Recognize malignant cells, cells infected with a virus. They must be activated by the pro-inflammatory cytokines of the dendrocyte, dendritic cells. But they recognize a malignant cell and they kill it. And then they also release cytokines. Remember, cytokine is a chemical that, one, attracts other white cells and increases or tells the B cells and the T cells to start replicating and producing antibody, or in the case of the T cells, making more T cells and start hunting down these infected cells. Start hunting down the pathogens. Immunotherapy for cancer. Therapeutic antibodies, interferons, interleukin-2. With an interleukin-2, it activates the killer cells. It's a chemical that activates the killer cells. They'll take cells out of a person. Generally, at this point, that's still kind of a last-ditch defense, a last-ditch trial in cancer. But they will get them all, they'll give them interleukin, they'll get them all activated, and then they'll put them back in and let them try to track down the cancer and hopefully either kill it or knock it back enough. Aging and stress. Cancer risks increase with age. Lymphocytes are still mutating. So, I think we talked about it right at the beginning of immunology. The lymphocytes are mutating constantly, and this, hundreds of thousands of mutations going on all the time. And this again helps them to adapt and to be ready for to seek out different foreign antigens. But as you get older, they continue to mutate, and they may lose some of their effectiveness. Stress induces the release of cortisone, which is known to suppress the immune system. Prednisone, cortisone, and so stress, when it's been proven many, many times that stress actually can be extremely harmful, and stress over a long period of time can be very harmful. Diseases caused by the immune system. Autoimmunity. Failure to tolerate self. Autoreactive or autoimmune T lymphs and autoantibodies produced causing inflammation and organ damage. Rheumatoid arthritis. Rheumatic heart disease.
Celiac.
Celiac, screw. You know, it's an autoimmune disease. Unfortunately, what you got to do for that is you got to give them prednisone. You got to knock down the immune response, which is the same thing that happens in stress. You know, stress, the cortisone is produced by the body. In an autoimmune disease, we're giving them prednisone. We got it because you knock down the immune response. And hopefully you can get them off it. But sometimes that just doesn't happen. Somebody with rheumatoid arthritis. Yeah, so they try treating with other drugs. But it doesn't work real well. Anyway, produced by failure of the immune system to tolerate self-antigens. Rheumatoid arthritis, you have antibodies against the IgG antigens in body fluids, especially in the synovial area, in the joints. And these antibodies get in there, they start attacking other antibodies. I believe they're IgM against IgG. And they cause inflammation. And you see people with rheumatoid arthritis, before the days of any kind of steroid therapy, and their hands are like this. They can't do anything. I've seen people that, the knee joints were so bad with rheumatoid arthritis, they went ahead and put artificial knees in. And that's kind of a godsend. Organ damage, causing inflammation and organ damage. You take your kid into a doctor for strep throat, that doctor is going to give that kid antibiotics, and he's going to give them really quick. Because the antibody that your body produces against the streptococcus will also attack the valves and some of the muscles in the heart. And that's the cause of generally rheumatic fever, which we don't see in this country anymore because kids do get antibiotics. But that would be the cause, that's generally the cause because it attacks the tissue of the heart valves and you get these heart murmurs or the hardening of the valves and a rheumatic fever. There are things that, we have made progress. Autoimmune disease, rheumatoid arthritis, type 1 diabetes. Type 1 is, you used to call it juvenile onset, but you're pretty much born with antibodies against the cells in the islets of Langerhans and the pancreas, and you can't produce insulin. You have to have insulin given endogenously, or you're going to die. That's just how it is. Multiple sclerosis. I'm not exactly sure on some of these other. Thyroiditis, psoriasis is against self again. Lupus erythematosus is a disease where your body's attacking its own nuclear material. Before the days of the ANA test, anti-nuclear antibody test, when we had a person we wanted to test for lupus, we would take a big vial of their blood. We would put glass beads in it, and we would shake it to break up some of the white blood cells. Not to mash them, not enough to mash them, but we would break it up so we would release the DNA or the nucleus out of the white blood cell. Then we would incubate it for 8 or 10 hours, and then we would make slides, and what you would see are other white blood cells engulfing these nucleus. So you'd see a white blood cell, it has its own nucleus, then it's got this big nucleus from the other white cell that it's engulfed because of this lupus antibody that tells it that the nuclear material is foreign. Now we have the NAs, and it's one hell of a lot easier when include those tests. Thyroiditis. I told you that the thyroid, the thyroglobulin is in the follicles of the thyroid. It is an immune
privileged site in that the body doesn't see it. If they do see it, then it makes antithyroid globulin. This is the basis for Hashimoto's, thyroiditis. And again, the body is attacking its own thyroid. Another autoimmune disease. Graves' disease is attacking the thyroid. Pernicious anemia. Pernicious anemia is the body's attacking of a factor in the intestine called intrinsic factor. And you can't give intrinsic factor because it's protein-based. And remember, with protein-based drugs like that, they're digested. So what you do is you give B12 shots. And now they have a sublingual B12. Anybody that's had stomach surgery and that, they give you sublingual B12. So it's absorbed right through the skin, and you still get your B12. Before they had that, before they had B12 shots, they would try to overpower the system, and people with pernicious anemia would eat pounds of liver until they got sick of liver and trying to just get enough B12 into the system to keep from developing problems. Autoimmunity. Antigens not normally exposed to an immune system. Hashimoto's thyroiditis. This is again thyroglobulin in the follicular cells. It gets out. Normally tolerated antigen combined with a foreign hapten. Drug interactions combined with platelets, resulting in the destruction of the platelets. These are, again, platelets do not renew themselves. Platelets are, formed, they live for 5 to 7 days, they die, they're pulled out by the spleen, and new ones come out. You expose those platelets to aspirin, they may be there, but they don't work. And the body may decide that the aspirin platelet combination is foreign, and then it'll start actively taking them out. I've seen it probably the worst delayed transfusion reaction. I mean, the lady didn't die, but it was pretty bad. And that she had an antibody, she created an antibody to cefotetan, a cephalosporin antibiotic. She was given it when she had her baby. We had what we call the delayed reaction, and we'll talk about that in a minute. Came back in, the doctor said, oh, you're bleeding, you might have a UTI, let's give you a bunch more cefotetan. By this time, she was already past the primary, so the antibodies had already been made, and they just attacked the red cells that we gave. As soon as the cefotetan attached to the red cells in this lady, the antibodies went in, and they hemolyzed. That, if you remember when we did one of our first labs, and you added red cells to distilled water, that's what her blood looked like when we pulled it out. And we transfused almost 100 units into her. Just to try to dilute out the antibodies. You stop the drug, and then you dialyze her, you transfuse her, you get as much of that out as you can. Autoimmunity. Antibodies aimed at other antibodies. That's your rheumatoid arthritis. Antibodies produced against foreign antigens cross-react with self-antigens. Rheumatic free fever, strep. Heart valves and glomeruli in the kidney. You can get a glomerulonephritis from it. It's just they are so similar to the antigens in the body that they will attack it. Self-antigens, several factors for autoimmune disease. Self-antigens made present to T helper cells along with class 2 MHC. MHC is the antibody carrier for histocompatibility, major histocompatibility complex molecules. You may get it after a viral infection, occurs in type 1 diabetes. These antigens are presented to the T cells, attached to this molecule. They're recognized as foreign, and the body goes after wherever they're coming from. Inadequate T regulatory cells. This is how a lot of cancers work. This is how a lot of autoimmune disease work. They're able to shut off the regulatory T cells. When your T cells get wound up, something's got to shut them off sometime. And that's what your regulatory T cells. Your FAS products can turn off the regulatory T cells. And if that means the regular T cells are just going and you have an autoimmune response.
Is it Steven Johnson's the same?
I don't know.
It's the skin. Like
Psoriasis type, yeah.
It's like very advanced now. We have a lady that's doing that. Yeah, really
Immune complex diseases. Again, you have, in the 1920s, they found that they could attach vaccines to various particles and have them become much more effective. If your body does the same thing in an autoantibody, you create an immune complex and it's more effective in attacking self. Free antigen antibody complexes stimulate complement proteins and inflammation. Usually self-regulating, because when you get complement, you're setting it up for either hemolysis or phagocytosis, but sometimes the inflammation will last long enough that they'll get to the organs. That's your body's complement system, again, attacking the body. Hepatitis B results in free complexes. They damage arteries, especially in the liver. Again, rheumatoid arthritis. The complex is formed by the strep and the antibodies that we make to strep attack organs, attack the heart valves, attack the glomeruli. It's an immune complex disease. Allergies. Allergies, it's more of a hypersensitivity and an abnormal response to the allergens. I don't know how abnormal it is. I think everybody has it. Two types. You have an immediate hypersensitivity. You're born with that. My father was a physician, and it was in the days, I actually started right about the time they developed penicillin, where they were able to commercially produce it and had enough that they could give penicillin regularly and quickly. And even at that point, back in the early 40s, beginning of World War II, they would give a guy a shot at penicillin and he would be dead by the time he hit the floor. This is an immediate hypersensitivity. He was born with that. As opposed to a delayed hypersensitivity. How many of you are allergic to poison oak? God, if you're not. But immediate hypersensitivity is B cell, humoral. Delayed hypersensitivity is T cell, cellular. It takes a while. You get exposed. For the poison oak, that oil has to be on your skin for a while before the reaction occurs. And a couple of days later, you start itching, and depending on what you've done and managed to wash it and spread it all over your body in the meantime, you can itch a lot. Then they give you cortisone. They give you prednisone to knock it down. This is okay because it's not a long-term thing. Immediate hypersensitivity, abnormal B cell response. Effects seen in seconds to minutes after exposure. Foods, bee stings, pollen. You ever seen anybody that's allergic to a food and allergic to shellfish? They damn near suffocate sometimes. Their throat swells up so badly. These are the people that carry the epinephrine syringes around. Bee stings, pollen, I don't know how, I haven't seen it to pollen, I've certainly seen it to these things. You have, there's your T cells, right here. What are these? Dust mites. Dust mites. You realize that, what is it, 70% of the dust in your house is just skin? Epithelial cells or shit? You don't want to hear it.
Is that a real picture?
That's a real picture, yes.
Unless you look
That's a real picture.
Why they don't line up the information the same way, like,
Well, they're attacking.
For real dust. It's real dust when you look outside.
This is that real dust?
Now, when you live in the country, I mean,
Yeah, Sherry and I live.
it's dirt.
Oh,
It's dirt.
I lived in El Centro. You know,
It's just.
you
can
didn't
in
dust
the
and
morning,
shoveled once a week.
Yeah.
It was so bad. Anyway, generally with the dust mites, it's not the mite that causes the problem, it's the feces from the mite. And they say there's, for every gram of dust, there's probably 10,000 little poops, for lack of a better word. Immediate hypersensitivity, dendritic cells, stimulated class, secrete interleukin-4, interleukin-13, which activates the B cells and plasma cells, secrete the IgE antibodies. The IgE antibodies are the allergic antibodies. That's what you see in the allergic reactions. Once these IgE antibodies do not circulate generally, attached to mast cells and basophils, when you're re-exposed, then they are released, the histamine, the leukotrienes, and it can be done very quickly. What does the histamine do? The leukotrienes attract the white cells. What does the histamine do? Dilates the blood vessels. You get a bad reaction like that, that's why people are dropping. Their blood pressure goes right through the floor. B cell, IgE, just for our class, know that your immediate allergies, your immediate hypersensitivity is going to be IgE antibodies and histamine release. B cell, IgE antibodies, histamine release.
Some people develop an allergic reaction or hypersensitivity when exposed to substances such as dust, pollens, animal dander, or penicillin. This hypersensitivity is mediated by IgE. Sensitization occurs when the antigen makes contact with some part of the body. The antigen is taken up, processed by antigen-presenting cells, and presented on a class II MHC to T helper cells. Tissues under the mucous membranes are rich in B cells committed to IgE production, and IgE-producing cells are more abundant in persons susceptible to allergies. The T helper cells produce cytokines which stimulate these B cells to proliferate and differentiate into IgE-producing plasma cells. As IgE is produced in specific areas of the body, the IgE molecules attach via their constant regions to receptors on nearby mast cells. Mast cells contain granules packed with chemicals that induce a hypersensitivity response. Once attached, the IgE molecules can survive for many weeks. The individual is now sensitized to the antigen. When exposed to the antigen for a second time, the antigen binds to the IgE antibodies on the mast cells. To trigger a response, two cell-bound IgE molecules must react with a specific antigen. Within seconds of the reaction, the mast cell releases histamine and other mediators of the inflammatory response from the granules, triggering a variety of symptoms.
Nasty. Delayed hypersensitivity. So a reasonable question might be which lymphocyte, type of lymphocytes mediates an immediate hypersensitivity versus a delayed hypersensitivity. It's 24 to 72 hours. It's from lymphokines. Chemical reactions, drawing lymphocytes, activating lymphocytes. It's not not a histamine effect. You don't take Benadryl for poison oak. It doesn't work. You take cortisone. Put cortisone in, or you take a prednisone.
Harmful effects produced by the mechanisms of cell-mediated immunity are referred to as delayed hypersensitivity. Delayed hypersensitivity is mediated by Th1 cells, also called TD cells, and is responsible for contact dermatitis, tissue damage in a variety of infectious diseases, and rejection of tissue grafts. A contact hypersensitivity, such as poison oak dermatitis, is initiated by contact with the antigen, which is also called the allergen. During contact, a small molecule from the plant, called a hapten, binds to a carrier protein in the host. The carrier protein with bound hapten is ingested by a macrophage, and the hapten peptide is then presented on the surface of the macrophage on a class II MHC. Th1 cells with T cell receptors capable of recognizing the hapten peptide antigen interact with the presented antigen, become activated, and increase in numbers. When the host comes in contact with the allergen a second time, the Th1 cells react with the hapten peptide being presented on the macrophage and release cytokines, resulting in attraction of more macrophages, followed by inflammation and skin lesions. Characteristic skin lesions appear after 24 hours, reaching their peak at 48 to 72 hours after the second exposure to the plant.
You guys really aren't all that sensitive to poison oak?
I've never had it, but I
Well, then you
maybe
probably,
I've never
if you,
touched it.
well, it's so common, I would be really surprised.
I don't have allergies either, seasonal allergies.
Lucky.
Can you develop seasonal allergies?
Absolutely. I didn't have allergies till I started working in Hollister. And then, you know, between the pesticides and the pollen and the different crops and all that. Until I moved to San Jose.
And then some people that have them, they kind of go away when they get older. Does that make sense or no? Not.
When they do go away, but it's not because you're not sensitive, it's because as you get older, your immune system starts to, to back off.
Oh, okay, your own immune system.
Yeah, it's not specific for that allergen, it's the fact that your immune system isn't working as well. Hence, the cancer, the diseases of aging, things like that. Okay, that's immune. Know the difference between cell-mediated and humoral immunity. Know what delayed hypersensitivity versus immediate hypersensitivity. Know how a vaccine works. Difference between attenuated, killed. Know how a vaccine works. You have the difference between a B and a T lymphocyte. You have questions on what a hapten does. We talked about that. You have MH1 and MH2. They react with the different lymphocytes.
What does the happening do again?
Hapten is a little carrier. It's essentially, when I talked about like in the 20s, they developed vaccines that were much more effective. So they found that they could attach this antibody or this attenuated virus to a hapten, which presents the antibody or the foreign object to the T cell and causes a much more aggressive antibody response. So they got much more efficient vaccines. Why don't we take about 20 minutes and then we will start in on the kidneys.